We are back on Morning Line. Thanks for joining us. Our final segment. Our guest this morning, Michele Johnson with Tennessee Justice Center, co-founder of that great organization. Mary Linder Salters with us as well, Tennessee Association of Alcohol, Drugs, and Other Addiction Services. We've got some folks that waited through the break with more calls, and we have someone from Kentucky. That would be Sean. Sean, good morning.
Good morning, Nick.
Hello, Sean. What's on your mind? Tell us what it's like in Kentucky.
I just don't know. I was wondering if your panel could answer a question or two for me.
Okay.
I was on low WellCare, which was a form of Medicaid.
Okay.
And then I was granted Social Security disability, and of course I had to take Medicare. Well, I see these TV commercials about if you are on Medicare and Medicaid.
Mm-hmm.
I'm just wondering if someone on disability is eligible for, both.
Yeah, generally, you could be, but generally, it depends on how much you're making. So you might be over income for Medicaid. But it kind of depends on your income, right?
Okay, income level.
But there are people who are dual eligible, and yes, you can be on both at the same time. It actually is a very good way to augment Medicare coverage for things that, like addiction treatment, that are not paid for. So,
okay, well, I'm glad you called, so you should apply.
And it does help with drug formularies as well. When you have both plans, it expands your access to medications.
Okay. And I didn't know if he was going to bring it up or not. So am I correct? Did they accept the expansion in Kentucky?
They did.
Okay, that's what I thought. And so can you give an example? I'm assuming they're not seeing as many hospital closures there as we are here in Tennessee, and that's the big reason why.
Right, and also we're #1 in the nation at medical bankruptcy. So less bankruptcies. Basically people who are getting mammograms. I mean, so if you look at like across every medical measure, like untreated diabetes, untreated asthma, preventive things that catch preventable cancers. Kentucky's beating Tennessee, and you can say, well, New York, California, it's just a whole different, there's a million different reasons, but the fact that Kentucky is beating us like a drum when they're our neighbor is just a shame. And we had one legislator who voted against this bill, and one of his constituents was Davy Crockett's descendant. Davy Crockett he actually lives on the family farm. He had been in, basically, obviously, his people had been here since Davy Crockett, but he had a rare neurological disease, Huntington's disease. He couldn't get treated because he couldn't get his job back. And he went and talked to his legislator about why'd you vote no, and the legislator told him to move to Kentucky. It seems like we can do better. It seems like we have to do better. And
Go ahead. Idiot legislators. What else do you?
Just one other thing on the Social Security disability. I think a lot of people think, well, if you really, really have a lot of disabilities, you're going to get Medicaid or you're going to get Medicare. And in fact, if you've paid in the system your whole life and you're determined to be disabled, so you qualify for Medicare, there's still a 2-year wait period. So those people, they're so disabled they cannot work, and they still have to wait 2 years to get Medicare. Those are the people who, in other states, are getting Medicaid expansion because they don't have enough money to qualify for premium subsidies. And those folks desperately need treatment because they're very sick.
Exactly.
But they're waiting 2 years to get that treatment here.
Some people can't afford to wait 2 years.
They really can't.
Let's go to Michele. Hi, Michele.
Hi.
Hey, Michele. What's on your mind?
My thing is they should expand the Medicaid.
Medicare?
About 3 months ago, I was looking for help for addiction treatment-wise, and I called everywhere, and everyone was like, oh, for a grant, you're on a waiting list, and blah, 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 blah. So I was thinking there was no hope for me whatsoever. But by the grace of God, I live in Nashville, I had to go all the way to Cookville on a grant just to get help. My thing is there's people out here dying left and right. I lost my sister not too long ago, and they really need to expand it. Like, I can't even get insurance. I filed for insurance. I cannot get insurance whatsoever. I got mental issues, and by the grace of God, I got on safety net. But that safety net only covers so much. You understand where I'm coming from?
Yeah.
Yeah. Well, to the caller's point, I mean, I alluded to that before. We only treat about 20% of the people who need treatment in the state, given our federal and state funding. There are waiting lists, and one of the things we do on the Tennessee Red Line is try to help people get on every waiting list that's possible that would meet their needs.
How long are the lines on the waiting lists? And what are we talking? Just give me a...
I did a point-in-time survey, and it's been 2 years ago. So this was January, I forget the date, in 2016. And at every state-funded residential detox program, of which there are roughly 21 in the state. There were over 1,000 people on the waiting list at every one of them. So it's a long waiting list. Now, those waiting lists have come down since then because of the federal cures money and some other things. So that is certainly not the case now, but there are waiting lists.
Yeah.
So I think that while that illustrated the need then, the need is still there. And to the lady's point, the addiction treatment system in Tennessee is such that every provider in the state-funded certainly, treats everybody in the state. There's not like there's a geo-access kind of a line. If somebody from Memphis needs treatment and the first open bed is in Chattanooga, we got to figure out how to get them to Chattanooga. And we do have some resources, and there are there's a program called the Tennessee Lifeliners.
Is it like a shuttle bus?
Well, there's a combination. Believe it or not, there's a little bit of infrastructure. It's everything from a church van to whatever. But we have people we can call, and we try to work it out wherever possible. But I know that there are also people who don't get to treatment because of those transportation issues. Like their number comes up on a waiting list and they can't get there. And
after waiting through 100 names.
And they miss an opportunity. I'm sure it happens. And people who, because they've been on a waiting list for a significant period of time, are kind of lost to the system. They can't be reached whenever their name came up on the list. Many people are moving around frequently trying to figure out how to manage an addiction, stay safe, and often are not living sheltered with their families. So, yeah.
All right, well, I just think that as we wrap the program up, folks that are watching this show that maybe think, all right, this makes sense. I mean, what do they need to do? I assume, vote. Okay, and ask your lawmakers. The thing is, a lot of the people that are on these waiting lists, I hate to say it, but probably the ones ain't voting. Okay, they're just not.
They're a little too transitory.
Yeah, exactly. Transitory, or they're dealing with addiction issues. Voting's the last thing on their mind. But I mean, I'm talking about people like us. It's a moral issue. It's also one whether one way or the other you look at it, it affects you. It affects your pocketbook too. Ask your lawmaker if they're for Medicaid expansion, and based on their answer, you can decide how you want to vote. Right? Is that it?
Well, I mean, I think we need people to understand the issues, and so we need folks, one, to spread the word, because there's some basic information on our website. If signing up for we have regular updates. Sign up tnjustice.org.
tnjustice.org.
It pops up with sign up for our newsletter. We'll give you information that you need to basically be evangelical about the facts on this issue, because we need everybody to be spreading the word, and then we need them to let their legislators know we understand this issue and what they expect. They expect, leadership, and they expect sound policy.
And we're going to get a new governor.
Yeah.
And so who knows? And there may be some changes in the legislature, some new faces anyway, and that's where you're pinning your hopes, perhaps, with changes there.
And I think with the opioid epidemic, we have put a face on addiction for the first time. It's now somebody you might know. It's somebody who perhaps more openly talks about it, and so it becomes more of a thing that you can relate to. And I think that's true for our legislators as well as people in our community. So putting a face on it and really understanding how Medicaid expansion, for example, would help people get access to treatment. If we can have educated voters out there who understand that, yes, all this money has come into our state for addiction treatment, but that is not sufficient to meet the need. Medicaid expansion is a vital piece of the puzzle in order to make that happen. I think we will have an educated legislature who can hopefully take that to where it needs to be, and a governor obviously as well, that needs to understand the impact of that.
Yeah, well, I know many of the gubernatorial candidates are talking about opioid addiction, but as Mary Linden told me earlier, and I think we all know this, is that addiction services go well beyond opioids, okay?
Correct.
There's a bunch of people addicted to booze, okay? Alcoholics and things like this and other drugs out there. So, you know, there may be some stigma attached to, well, that person's addicted to opioids. I mean, I would never do that, whatever. But at the same time, you're sure to know someone out there that's got a drinking problem. And if you don't, I don't believe you. You have to know someone out there that does.
Yes.
And so it goes well beyond just opioids. Let's keep that in mind, all right?
It does. Just because we've clamped down on things like the number of days for an opioid prescription or things like that, which are very well founded and needed, at the same time, addiction doesn't go away just because you limit access to the drug or to a prescription. People move on to heroin or meth or other things when they can't get access to an opioid and they can't get access to treatment. You know, you have to kind of feed the need until you can get you know, some relief, you know, hopefully through treatment. But at the same time, I think it was said the other day that, you know, 64,000 people died in 2017 from an opioid-related overdose, and that is more people than died in the Vietnam War. That kind of gives you the face of how many people, you know, are died just last year. But the same year, 2017, 88,000 people died from alcohol-related conditions. So yes, 64,000 is huge, and we want to treat it. But 88,000, you know, that doubles it. And then we talk about other kinds of addiction. We have a huge problem and a huge unmet need. And again, Medicaid expansion is just another tool in our toolkit to be able to give people access to care.
Real quick, we just have about 30 seconds. Tennessee Red Line number, and again, folks can call that, and we'll give it again at the end of the show. But
1-800-889-9789. I have.
And that is where people can call
for addiction treatment referrals, whether you have insurance, TennCare, or uninsured or underinsured.
Okay, and I know you probably missed that, but grab a pen and paper, and when we come back from the break after I say goodbye to our fine guests, I'll give you that number again. Thank you both for coming on. Keep fighting the fight. You guys do good work and you help people, and I really appreciate you both for that. Take a break. I'll be back to wrap things up and give you that phone number right after this.
Hi, John.